Hello, I'm Fast Lawyer. Today we're doing a Let's Play and very early impressions for Dentist Simulator 2 VR, a game released on the Steam store back in October of 2025. It normally retails for $15. I did buy this game, and I'm playing it on the Meta Quest 3 using virtual desktop on my RTX 1580. Now, I did turn off the music, so music was actually playing, and it was like this Brazilian funk song. I don't know if you guys are familiar with Brazilian funk, but it leads me to believe that the developer is probably Brazilian. So, you have this tablet, and I did start a career, and there is a bit of jankiness to it. But let's look around a little bit before we actually start. Okay, this is kind of weird. The drugstore too. All right, let's go ahead and let's start. Yes. So, evolution of your dental education first year. So, I've already done a couple of these early ones, but let's go ahead and play. Right.
Let's get to know some of the main dental instruments you will use throughout the
And you see, this guy's actually the one talking, or at least he's moving his mouth.
And understanding how to use them is essential for performing procedures with precision. The first one is clinical mirror, used for indirect visualization and aiding in clinical diagnosis. It allows you to observe hard-to-reach areas and reflect light during the examination. Look for this instrument on the clinical table and pick it up.
Now, you do have full locomotion and snap turning. I am having to play standing because I was just too low to the ground when I played seated.
You got it right. Exploratory probe, an active-ended instrument, essential for detecting cavities and irregularities. It helps in checking the integrity of enamel and the presence of tartar. Grab this instrument.
Okay, what? Grab which instrument? I guess this one.
Excellent, that's the one.
Explorer probe.
Tweezer, used for handling materials and applying topical anesthetics. It ensures precision when handling cotton, gauze, and other supplies. Take a look at the clinical table and pick up this instrument. That's right, correct. Still using the cotton pliers? Hold a cotton ball by gripping it with the instrument. Once again with the cotton pliers, pick up a piece of gauze and hold it. You're getting the hang of it. Scalpel, used for making incisions and precise cuts in gingival tissue. It is fundamental for periodontal surgeries and invasive procedures. Grab this instrument.
Scalpel,
Yes,
sorry.
that's the one. Carpule syringe, used for administering local infiltrative anesthesia. It allows precise control over the volume and pressure of the injection. Look for this instrument on the clinical table and pick it up.
Oh, crap.
Excellent. That's
There we go.
The one. Spatula number 7, Tucturonarsin, syndesmotome, used to detach the gum tissue around the teeth. Indispensable in the initial stages of extractions and gingival surgeries. Take a look at the clinical table and pick up this instrument.
I have no idea which one it is. It's not that one.
You're getting the hang of it. Forceps and elevators. Instruments for tooth extraction and removal of residual roots. They allow controlled traction and leverage of the dental element. Grab this instrument. That's right, correct. Stainless steel hammer. It's allowed in the game, but in real life, don't even think about it. Ideal for relieving stress.
For comedic effect only.
Not the patient.
Not gonna recommend it in real life.
And a sense of humor. Look for this instrument on the clinical table and pick it up.
This is a weird game because it's a dentist simulator that takes itself kind of seriously.
You're actually pretty good at this.
But does allow for some hijinks,
right?
some trolling, some comedy.
You've already got the basics. So pay close attention because the information I just gave you will be extremely important for you, doctor. If you'd like, you can watch it again anytime using the tablet in the office. I highly recommend watching not just this lesson, but all the others that are available. Now go ahead and may your treatments go well.
So it seems like the information given is pretty accurate.
When we think about the classification of teeth and their function, it is important to remember that teeth can be divided into 4 main types: incisors, canines, premolars, and molars.
I'm actually learning
But
stuff
to
with this
identify them
game.
precisely, we use a numbering system based on quadrants. Imagine the mouth divided into 4 parts. Quadrant 1, upper right side of the patient. Quadrant 2, upper left. Quadrant 3, lower left. Quadrant 4, lower right. Each tooth receives 2 numbers. The first indicates the quadrant, and the second its position. For example, tooth 11 is the upper right central incisor. Tooth 21, on the other hand, is the upper left central incisor. With this system, we can locate any tooth quickly and accurately. Sounds easy, right? But in practice, it takes a little time to get used to it.
Mm-hmm.
Now take the numbered pieces on the table and identify the correct quadrant on the dental arch.
Now, as you can see, there's a little bit of jank. As you see the numbers here, kind of getting blocked by the table, so it definitely needs. You see how it's clipping across the table? That really shouldn't happen. But actually doing the task is not difficult. I mean, even a kindergarten kid could probably do this.
Congratulations, you got
as long
it
as they
right.
know their numbers.
Incisors are the front teeth, located at the front of the mouth. Their main function is to cut food. Within the incisors, there are central incisors and lateral incisors. The central incisors are the 2 front teeth, while the lateral incisors are located next to
I
the
am
central
playing seated
incisors.
now. You can see that I am
Shown
too
on
low
this
to the
side.
ground.
Lateral incisors, like the central ones, also help cut food, but they play an important role in the balance and aesthetics of the smile. Now let's go through the entire dental arch with the goal of helping you better memorize.
So
the
you
tooth
do have to
numbering
play
system,
standing, but I'm
as
playing
it will
seated
be
right now.
essential during treatment. Start with the following teeth: upper right central incisor.
Look, there's even a sterilization room.
Upper
Wow,
left central
pretty
incisor,
impressive.
21. Lower left central incisor.
You know, for $14.99,
31.
I had
Lower
very
right
low
central incisor,
expectations for this
41.
game.
Take the teeth laid out on the table and place them in the correct positions on the dental arch.
Now, this is really not that difficult because it tells you already where they're going. Now, I don't know if you could look at the teeth and be able to tell, but I don't think so. But you see how this one tells you it. Wow. Actually, I did that one wrong. It goes like that. But you see how they're marked already? And you can sort of tell the bottom teeth from the upper teeth because the pointy is
That's right,
will
correct.
tell you the direction.
Canines are the pointed teeth located next to the incisors.
The pointy end will
Their
tell you the
function is
direction.
to tear food, especially more fibrous foods. Once again, find the teeth on the table and place them in their correct positions on the dental arch.
Again, even I think a kindergarten kid could probably do this part. It does get more complicated though. So this
Excellent.
is
That's the one. Premolars are located between the canines and molars, and their function is to crush and grind food. They have a broader, flatter surface, which makes chewing easier. Take the teeth laid out on the table and place them in the correct positions on the dental arch.
a harder thing would be not to mark them and just kind of make you figure out where they're supposed to go based on the information that you've been given, but that would probably be too complicated.
You got it right. Molars are the most posterior teeth located at the back of the mouth. Their function is to grind food, helping break it into smaller pieces. Take the teeth laid out on the table and place them in the correct positions on the dental arch.
Now, obviously, I would like the ability to adjust height. That way you could play seated, comfortably seated. And it also needs smooth turning. And maybe some graphical options. But it seems to be running at a steady 90 frames per second on my RTX 1590. So performance seems to be fine, at least on my high-end rig.
Congratulations, you got it right. In addition to chewing, teeth also play an important role in speech. They help form sounds, allowing for clear pronunciation of certain words. Dental health is crucial not only for efficient chewing, but also for good speech and self-esteem.
No, there's not.
Understanding this division and the role of each tooth is essential for anyone starting their journey in dentistry. This was a very important presentation for the beginning of your professional experience. If you still have any doubts, repeat this explanation to better retain the content. Bye.
You know, this game actually does have... Where's the tablet? Where'd the tablet go? Like I mentioned, there is some jank to this game. And right now the jank is the tablet's missing. I'm not sure why it... But at least it respawned over here, right? But you saw the tablet was in my holster and it disappeared. Let's go over there before... you can run, so that's good. Because the normal walking speed is very slow.
About the anatomy of oral tissues, we can say that teeth are not isolated within the oral tissues. They are part of an integrated system called the periodontium. This is a set of tissues that support and protect all dental elements. It is important to highlight that the periodontium is divided into two parts: the supporting periodontium and the covering periodontium. The supporting periodontium is composed of the alveolar bone, periodontal ligament, and cementum. The covering periodontium is formed by the keratinized gingiva and alveolar mucosa. Therefore, when we talk about the dental alveolus, we refer to the bony cavity that houses the root of the tooth, while the gingiva acts as a protective barrier for this region. Commonly, when people think about the structures of the mouth and their functions, they tend to associate them only with food, the tongue, and the teeth. However, the stomatognathic system goes far beyond that. It includes a wide range of important structures such as the upper and lower lips, the alveolar mucosa, keratinized or not, the buccal mucosa, the cheeks, the hard palate, the soft palate, the interdental papillae, and many others. Now you will learn how to make the patient open and close their mouth, moving their lips to the right and left so the treatment can begin. Now pick one of the instruments on the table and try to encourage the patient to move his lips, making him open and close his mouth. But pay attention. Once you find the correct position, press the indicated button on the gizmos to lock and set the desired position. Very good. You have successfully understood the basic control of lip movements for the procedure. To reinforce, you should pick up an instrument and bring it close to the patient's mouth, which will then gesture automatically. After that, you need to fix the desired lip position. When considering dental anatomy, we must remember that dentine forms the body of the dental element, while cementum covers the root of the tooth, enabling the attachment of the periodontal ligament to its surface. Thus, the balanced interaction between these structures is essential to ensure the stability and health of the teeth.
Wow, he's missing several teeth.
Bleeding, it may be a sign of gingivitis.
His teeth look good, but he's missing several teeth.
Bacterial plaque on the teeth. If not removed, plaque turns into tartar, which is the hardened and calcified part of the plaque. Tartar irritates the gingiva, causing inflammation and bleeding. If left untreated, gingivitis can progress to more serious problems, such as periodontitis, which affects the supporting tissues of the teeth. Now pick one of the instruments on the table and try to encourage the patient to move his lips, making him open and close his mouth. But pay attention. Once you find the correct position, press the indicated button on the gizmos to lock and set the desired position. That's right, correct. Caries, on the other hand, is caused by bacteria that feed on sugars, producing acids that destroy the tooth enamel. This process can be associated
look at all his
with
missing
bad breath
teeth.
due to the presence of bacteria
Definitely
that
needs
release sulfur
dentures.
compounds. Therefore, it is important to remember that perfect brushing should be done twice a day with a soft bristled toothbrush and fluoride toothpaste. The nighttime brushing is the most important, and when combined with the use of dental floss daily, it removes all plaque and food debris between the teeth. So remember, these practices, along with regular visits to the dentist, are essential to prevent cavities, bad breath, and maintain oral health.
Now, he seems to be happy. I think you needed some training on how to use the chair and the mirror and this light, I mean, prior to those exercises. So I don't know if later on maybe there's some So now we're going to do local
Local
anesthesia.
anesthetics are used in clinical practice, differing in onset, duration, and anesthetic potency. Lidocaine, for example, stands out for its rapid action and safety profile. Mepivacaine is indicated for short to medium procedures.
Yeah, this is definitely a
especially in
Brazilian
patients with
developer.
restrictions on
This
the
is in
use of
Portuguese.
vasoconstrictors. Bupivacaine, on the other hand, has a prolonged action.
Oh, but
making it
this one's in
ideal for
English.
longer procedures.
Oh, okay.
Articaine, due to its excellent
This one's in
tissue
Portuguese.
diffusion, is effective in difficult nerve blocks.
50
While
carpus.
cytokine, usually
Venda
combined with vasoconstrictors, is used in
prescrição.
procedures of intermediate duration.
Solução
An important component of local
injetável
anesthetics is the
bucal.
vasoconstrictors.
Uso
These
adulto e
substances
profissional.
constrict blood vessels, slowing the absorption of the anesthetic, thereby prolonging its effect and reducing systemic toxicity. Filopressin is an alternative vasoconstrictor to
Cytocaína.
adrenaline or noradrenaline, and is especially indicated for patients with heart conditions. The metabolism of these drugs.
Yeah, I wonder where the
occurs mainly
developer's
in
from.
the
I'm
liver,
pretty sure it's
while
Brazil.
excretion takes place primarily
Maybe they're
in the
from
kidneys.
Rio?
Amide-type anesthetics, such as lidocaine
Rio
and
de
bupivacaine,
Janeiro.
are predominantly metabolized in the liver. Articaine, however, is partially metabolized in the plasma,
Maybe
and
Sao
to a
Paulo?
lesser extent in the liver, making it more suitable for patients with hepatic dysfunction. In cases of renal impairment, it is safer to use drugs with lower renal excretion or fast hepatic metabolism, such as lidocaine. In clinical practice, the dental surgeon, in addition to mastering pharmacological theory, must also possess the technical skills necessary to correctly apply the different existing anesthetic techniques, ensuring both safety and comfort for the patient. In general, the main methods of administration used are topical application, infiltrative anesthesia with a syringe, and inhalation administration. The
Ooh,
first technique we will
inhalation.
address is topical application.
Okay, topical.
This
Yeah.
consists of depositing the anesthetic on the surface of the oral mucosa, usually in the form of a gel, spray, or ointment.
Oh,
It is indicated to reduce initial discomfort during simple procedures or as preparation for needle-based techniques. Pick up the clinical tweezers with cotton and dip them into the topical anesthetic located on the clinical table.
what I want to do is
Afterward,
lower
use
the
a cotton
table because
swab
it's a
to
little
rub the
high.
mucosa of the region you wish to anesthetize.
Is that good enough? You know, I'm not really getting the best light here. Okay, hopefully that works. Get the cotton swab, put the gel, and oh, do we get the mirror? Oh, okay. I'm gonna have to do the mirror first. Hold on. There we go. Now we get the cotton ball, the gel.
Nice, that's the way. As for the infiltrative anesthesia technique, this is performed using a carpule syringe and needles of various lengths. The choice of needle depends on the depth of the anatomical structure to be reached. Short needles are preferred for superficial tissue infiltrations, such as in the maxilla. Long needles are indicated for deeper nerve blocks, such as the inferior alveolar nerve block in the mandible. Terminal infiltrative anesthesia is performed by applying local anesthetic near nerve endings, leading to loss of sensation in the targeted area. Hold the carpule syringe and apply the anesthesia to the desired area.
So it should be right here in this area. Oh, I got the wrong one? No way. Wait. Oh, you see it? It's spazzing out. You saw that? Wait, why is it not? Wait, what's going on here? Am I not reaching far enough? Oh, sorry, dude. My bad. Okay, I
Awesome. In summary, trunk anesthesia
Okay.
blocks a larger area. It targets
That
the
was
trunk
funny.
of a major nerve.
I almost
providing
killed the
broader
dude.
anesthesia. Peripheral nerve anesthesia, on the other hand, works in more localized areas. It blocks the smaller branches that extend from the main nerve, affecting more specific, limited
He's a
regions.
personal trainer, bachelor's degree in
A third
physical
approach,
education.
which has been widely used in patients with needle phobia, is the administration of nitrous oxide
Yes.
via inhalation.
Let's get
also
some
popularly
nitrous.
known as
Yes.
laughing gas. This nickname stems from the mild euphoric effect it can induce in some
Yeah, where's the
individuals
nitrous, man? Give me some nitrous.
However, it is a potent anxiolytic and analgesic agent that acts on the central nervous system to promote conscious sedation, reducing discomfort and anxiety during dental procedures.
Yeah, but where's the
Caution is
nitrous,
required,
man?
especially in patients with pre-existing cardiovascular conditions. In such cases, its use must be carefully evaluated, as although it is generally considered safe, it may affect hemodynamic stability and, in more severe instances, trigger episodes of heart failure if not properly monitored.
Whoa.
At this moment, take the nasal mask and place it on the patient, gradually increasing the gas flow.
Where's... Oh, is that the No, that's not the nasal mask. What nasal mask? What are you... Oh, it's right behind me. Okay. All right. This is about to be fun. Okay. Now what? Do we increase? What do we do? Do I put more? Let's increase it to 50%. Are you having a good time, sir? What do I do now? Do I put it all the way to 100%? I don't want to kill the dude.
Easy him. Or he might lose consciousness.
All right. Yeah. That was fun. Got to admit. Oh, dental extraction and its complications. Dental extraction and its complications. All right, let's see.
Let's now talk about tooth extraction. It is indicated when a tooth can no longer be preserved, being a common procedure in clinical practice. For example, when the destruction of the tooth structure prevents any type of functional restoration, or when there is advanced periodontal disease with significant bone loss, compromising the support and stability of the tooth. It is also indicated in cases of root fractures that make recovery unfeasible, in impacted teeth, such as third molars, that cause pain or oral infections, and in the rehabilitative planning of dental implants. Tooth extraction requires extensive technical and theoretical knowledge from the professional, in addition to self-control, anatomical understanding, and manual dexterity.
This sounds
In
like
other
fun.
words, technique, patience, and gentleness are essential for a safe extraction. The main instruments used are
Or we're just
forceps
gonna wing
and
it.
elevators, also known as dental extractors. The
Forceps.
steps for a
All
simple
right.
tooth extraction generally include topical application of anesthetic, infiltrative, nerve block, or peripheral nerve branch anesthesia, intrasulcular incision with a scalpel, gingival detachment using periotomes, tooth luxation with forceps, using gentle buccal movements to
Quick
expand
time
the
event,
alveolar
huh?
bone. If the tooth fractures, elevators may be used to facilitate the removal of the residual root. Pick up the clinical tweezers with cotton and dip them into the topical anesthetic located on the clinical table. Afterward, use a cotton swab to rub the mucosa of the region you wish to anesthetize.
Yeah, but before we do that, we want to open his mouth first, right?
Mm-hmm.
Let's lock it in. Lock it in. All right. There we go. So now we're gonna get the tweezers. Oh, no, those aren't the right ones. Okay, so the bottom.
At this point, the patient's gingiva is already anesthetized, which makes the needle prick significantly less painful. Hold the carpule syringe and apply the anesthesia to the desired area.
Which is this tooth right here.
At this point, the patient should no longer feel pain, and you can begin the incision with the scalpel. Pick up the scalpel and gently make an incision in the mucosa.
I don't know what that means, man.
With this, you've incised the gingiva, outlining an intrasulcular line that will serve as a guide for gingival detachment.
Okay. What are we supposed to do, man? I don't know what you want me to do. I think we're doing
Yes,
the
that's
right.
the one. With this step completed, you can now visualize the entire alveolar bone and have detached the gingival fibers from the tooth surface. Grab the forceps, hold the targeted tooth, and extract.
Oh man, I'm sorry, sir. I apologize ahead of time. Oh crap. How do we? I don't know that this is like crap. Maybe it's better to do it left-handed. Does it even work this way? No, it doesn't seem to want to work this way. Okay, let's do it right-handed. Oh, I almost had it. Oh, there's like a little quick time event. Okay. Oh wait, which button? What does it want me to do?
When excessive force is applied during extraction, it can make the procedure more difficult to complete. In such cases, the forceps may no longer be able to grip the tooth properly. The only remaining options are to use dental elevators or perform mastectomies with a rotary instrument. In summary, after completing anesthesia and gingival detachment, use the forceps to extract the tooth. If the tooth fractures, you can still remove it using elevator-type instruments, applying wedge and shear movements.
I don't know what.
Hold the elevator and remove the remaining root. This direct pressure helps with clot formation. After a tooth extraction, it is essential that the patient follows all professional guidelines, such as taking prescribed medications, anti-inflammatories, and antibiotics, and applying ice to the outside of the face within the first 24 to 48 hours after the procedure. A simple measure that helps reduce swelling and local discomfort. It is also crucial to rest during the first few hours, not to rinse the mouth during the first 24 hours, as this could dislodge the clot, and never to tear the sutures, as this compromises healing. If there is intense pain, excessive bleeding, fever, or any abnormal signs, the patient should immediately contact their dentist for evaluation. Excellent. You have completed all the steps of a simple tooth extraction.
Yes.
Now just keep practicing to improve your manual skills and surgical technique. Bye.
All right. Money, make that money rain. Yes, we're making the money rain. It's raining money.
Follow me to the sterilization room, please.
All right. Cuidado, caution.
To ensure the safety and proper hygiene of the instruments, carefully follow the sterilization protocol. Make sure to complete each step accurately to maintain the effectiveness of the process. Check the list for all required materials. Fixed on the wall right there. Submerge each instrument in the germicide for 5 seconds. Rinse them under running water. Place them in the drying area. Transfer them to the metal box. Place them in the autoclave and start the cycle. With this, you will have completed the entire sterilization process and can return to dental care.
Do we just drop it, or how do we do this? Wait, huh? I'm so confused. So we got the pliers. Mm-hmm. Look at the color of the dental and follow these steps below. Okay. Oh, okay. Then green. Okay, I see. Do we just drop it? Okay, now it's yellow. Okay. Place the instruments in the middle, then transfer the... Wait, how do we... Oh, okay. Okay, but how do we close it? Okay, you just press on. Okay. We can't see our own reflection. We must be vampires, which I suspected. The special tweezers. So the dental tweezers. I guess we just drop it. Oh, hold on. Hold on. It says drop them in the middle box, then transfer them to the autoclave. Oh. Oh crap. Come on. Okay. Oh. Crap. Okay, let's do that, I guess, all again. Okay, and then green. And I guess we're doing the whole no, we're not. The pliers? We can just drop them over here again. Yellow. Oh, okay, I understand. Okay. Two, 1, 0. Okay. I was a little confused.
Remember that this sterilization cycle will be
okay, I get it
routine. Now. After all, the instruments in your office won't clean themselves. So get used to it, doctor.
Yeah, but I'm pretty sure doctors don't do this. I'm pretty sure it's their dental assistant. So, that's one inaccuracy of the game, but yeah, we'll forgive it. So let's grab our tablet. Let's go. Oh, there's more. There's a lot more. No, wait. No, there isn't.
Below, we will present the 3 main infiltrative
we're in the
techniques
last...
most commonly used in professional practice.
Okay, we're in the last step.
The mental nerve technique, the infraorbital nerve technique, and the 3-point technique known as Gaugates. The mental nerve technique involves injecting the anesthetic near the mental foramen, through which the mental nerve passes, a branch of the inferior alveolar nerve. It allows for the blockage of sensation in the soft tissues of the anterior mandible, including the lower lip and vestibular gingiva of the lower incisors, canines, and premolars. Pick up the carpule syringe and perform the Metonian foramen technique on the right side of your patient.
The what? 2-6 right side mental nerve anesthesia. Right side? Right side. Is it his right side, or is it to my right, or his right? I'm going to go with his right, so it'd be my left. Do we go like this, or... Is that... Let me look at the board. I'm this one's the confusing one. So mental foramen, mandibular. I think he said this. So it's right. Ooh, okay. I see. Ooh, it's up. It's really back there. Okay. All right. Let's try that. Oh, you already closed. Why did you do that? I'm trying to open your mouth, dude. I can't. There we go. Let's lock it in. Let me begin. Jump around. Jump around. Okay, we gotta lower you, man. You're too high. Okay. Wait. Yeah, that's his right. This is his right. Crap. Why is this not working? Crap. So you see there's some jankiness here. Let me lower it some more because I think it's still too high. All right. This is about as low as it goes. Oh, crap. Come on. Or maybe it's his right. Maybe it's my right. Let's do the other right. Again, there's a little bit of jankiness here. Crap. Oh, wait a minute. I can see the tooth. It should be over here then. Wait, you see that tooth right there? I mean, I don't know what else I can do. We might have to skip this one because I'm really not sure what it wants me to do. Or we can restart it, I guess. Let's restart it. Maybe there's something that we... Let's restart.
We will present the three main infiltrative techniques most commonly used in professional practice. The mental nerve technique, the infraorbital nerve technique.
I'm going to lock in and pay attention.
Technique known as Gaugates. The mental nerve technique involves injecting the anesthetic near the mental foramen, through which the mental nerve passes, a branch of the inferior alveolar nerve. It allows for the blockage of sensation in the soft tissues of the anterior mandible, including the lower lip and vestibular gingiva of the lower incisors, canines, and premolars. Pick up the carpule syringe and perform the Metonian foramen technique on the right side of your patient.
I think he said mental foramen. Right? Right? Am I wrong? Is that what he said? Let's try to do that. No. Don't. There we go. Lock in. It should be... Oh. It should be right here, actually. Right? Isn't that where it is? Am I wrong? The only other thing I can think of, it's right here. We might have to skip this one because I'm really not sure. Because I see the diagrams, but I kind of feel like I've already done all of them. Like, I'm pretty sure that's where it is. It would be really helpful if we could see some progress. That way we know we're on the right track. I'm going to try the other side, but at this point, I just don't know. We might have to just give up and act like we passed when we didn't. As you can see, there's a little bit of jank with the needle. It's going all kinds of ways. And obviously it's not helpful. Okay, I'm looking at where the targets are. I think I'm getting to where they are, but I think he's at mental foreman, so it should be right there. Let's go to the other side and try to do it that way. No? Okay, well, let's try it that way. No? Let's try it this way. No? I mean, part of the problem is just it doesn't want to go in there. It really doesn't. I kind of feel like I've tried every single spot possible at this point. It's just not working. All right. We'll just assume that we passed. Let's get on to our first patient because this video is already pretty long. So, yeah, I wasn't able to pass the last one, but that's okay. We can just go to appointments, day 1, yes. Jay, let's...
Let's begin the appointment. Pick up the clinical tweezers with cotton and dip them into the topical anesthetic located on the clinical table.
Yeah, before we do that, let's lock it in. Topical anesthesia.
Correct, you've got the hang of it. Hold the carpule syringe and apply the anesthesia to the desired area.
That should have worked. I'm not sure why it didn't.
See that? When the anesthesia is done properly, the patient doesn't even flinch. Slow down.
Let's go ahead and go with the incision. I don't want to keep repeating that. So incision right here.
See that? When the anesthesia is done properly, the patient doesn't even flinch. See that? When the anesthesia is done properly, the patient doesn't even flinch.
So he's missing so many teeth, it's hard to keep track. Okay. Let's do this here.
With the right dose of anesthesia, you can work calmly without causing pain.
Okay. Now the forceps. Oh, crap. Like I said, there's a little bit of jank here.
See that? When the anesthesia is done properly, the patient doesn't even flinch. The conduct was way too reckless. You caused unnecessary pain and left the patient scared. That's not acceptable, doctor. You're being too heavy-handed. Remember, dentistry is not torture, it's technique. Take better care next time. Don't mess up again, got it?
Margaret, you're next.
Another brave patient has arrived.
Bracket placement. I guess braces bonding. Okay, ma'am. There's no reason to be scared. I'm a professional.
Grab the bracket tweezers. Finish bonding the braces.
I have no idea what this means. We didn't, okay. All right, there we go. Topical anesthesia. Okay. So we're going to get the tweezers. And we're going to... So this front one only, right? There we go. Okay. Infiltrative local anesthesia. Okay. And...
With the right dose of anesthesia, you can work calmly without causing pain.
Okay. Incision. Okay. All right. I think that's it.
With the right dose of anesthesia, you can work calmly without causing pain.
Okay, I think. Okay, all right. Oof. Okay, forceps. Wait, are we doing the same thing? Why is bracket placement almost the same? Well, it doesn't matter. Let's go ahead and do this. Oh man, we got to be careful. Look at this.
No response to touch. That's a sign the anesthesia took effect just right.
Yeah, but I'm trying to pull the right tooth. It moves around too much. Like I said, this game isn't. It's a little on the janky side. Wait, I'm not. I only want to pull one tooth. Why is it doing? How do I get it to only do one tooth?
No response to touch. That's a sign the anesthesia took effect just right. That looked like a beginner's work. You couldn't let the patient suffer like that.
What the hell?
You should have positioned them better, tilting the chair properly. Or if you don't know how to use infiltrative anesthesia correctly, use the nitrous oxide device. That way, the patient stays relaxed and the procedure flows better. Understood?
You should have told me that earlier.
Your patient is already waiting. Let's get started.
Let's go. Oh, hello.
Pick up the clinical tweezers with cotton and dip them into the topical anesthetic located on the
Ooh,
table.
look at her teeth. Oh my God. Okay, she's super hot, but then you look at that and you're like, oh, no, thank you. Topical anesthesia. Wait, I don't see. Oh, okay, that tooth. Okay. Why are we doing the same steps for everything, though? It doesn't make sense. But let's go ahead and. Ooh.
Nice, that's the way.
Okay, all
Hold
right.
the carpule syringe and apply the anesthesia to the desired area.
In fact, let's gas her up because I don't want any problems. All right, there we go. It's at 72%. Let's gas her up. Oh yeah, you're having a fun time already. Okay, all right. So now what? Incision. Let's do this.
With the right dose of anesthesia, you can work calmly without causing pain.
Well, I think that's already the incision. And okay. And the forceps. Why are we doing the same things for everything though? That's the thing that's throwing me off. Wait, this doesn't make sense. It says late implant placement. Please follow the instructions carefully by checking each procedure on the instruction panel. But what is there that we're taking with the forceps? I think we're using. Aren't we using these? Like in this. Like isn't this something that we put? How does this work? Wait, I'm so confused. So, this game does a poor job of explaining some of the things that you need to do. Yeah, I don't know what you're supposed to be doing. Perform syndis. Okay, it's still on that one. Okay, but I thought we already did that. Perform syndostomy.
No response to touch. That's a sign the anesthesia took effect just right.
Yeah. Now what? Place dental implant. Okay. So do we do it like which teeth is this again? So is it this? Wait, is it the top or the bottom one? So is it like this?
Correct. You've got the hang of it.
Place
Seat the
aesthetic crown. How? I never learned this. Do we pick this up or where is the crown? Like where? Let's not hit her. I was raised not to hit women. So we're gonna hit the doctor. Oh, that doesn't work. All right. Oh, there's two. Oh, the prosthetic lab. Okay. So where's the prosthetic lab? I'm so confused. Is there? let's look around. So this is the drugstore. I don't think we're. Oh, the meat hammer. Where are the prosthetics? Yeah, how do we? How do we get these? Where is it? Where are the prosthetics? I'm so confused. Place aesthetic crown. Well, where is it? If I knew where it was, I would definitely put it on there. Yeah, this was never explained, and I'm so confused where we would get the crown from. Do you know? Is it maybe we do this? Hold on. No? I don't think so. Do we? I don't know. I don't know how to do this step. I think I'm gonna have to end the video here. I do like this game, but it troubles me that we're supposed to get this tooth from the prosthetic lab, but as you can see, I don't know where we would get it from. Like where I think I've looked everywhere. Is it maybe over here? Maybe? No. There were no lessons on this. Hello, ma'am? Do you know where I? Yeah, I think we're just gonna have to end the video here because I have no idea where we would get the prosthetic tooth from. I have a feeling maybe this has something to do with it, but how we get it from here, I have no idea. It says orthodontics. Yeah, I'm confused. Where do we get this aesthetic crown? Oh, is it here? No, this is like to clean teeth. Not there. That's for water, but where? Yeah, I don't know. Oh, that's it? Point and click? Oh, okay, well that was dumb. I did not expect a point and click mechanic there. It kind of takes you away from the immersion. And nothing else was done like that before. But that was my first successful dental job. So I have mixed feelings about this game. On the first hand, there's a lot of very useful knowledge here that you learn about dentistry, and I like that. And parts of it were fun, but parts of it were too janky. And as you saw there, putting the tooth in was just point and click from this, and that was really bad. So if I have to rate this, again, this is budget price, only $15. Early impressions, not a full review. I'd give it a 6 out of 10. I don't regret my purchase. This is about what I expected. Maybe it's a little bit better than what I expected, but parts of it were bad. And the worst part was what you just saw there, where it was you put the tooth in with just a point and click. That's just lazy. But, it's only $15, so what can you expect? The developer has some updates to this game. I don't know if there are going to be further development because it didn't sell well. But who knows? I hope they do because I think there's a good promise. There's a good promise of a future good game if there's more work put into it to make it more smooth and polished and with more dental variety in the jobs that are immersive and not point and click. Anyways, I'm Fast Lawyer. Thanks for watching. Have a wonderful day. Goodbye. I'm going to go back and sit down because I've been standing around here for quite a while. Thanks for watching. Have a wonderful day. Goodbye.